Good afternoon and welcome to HealthSystemCIO.com's All-Star Panel, Profiles in FHIR, a webinar tweet chat combo from HealthSystemCIO.com sponsored by Infor. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view it in the WebEx Media Viewer panel on the right-hand side of your screen to see what people are saying. Other WebEx panels we're going to use today are the Q&A panel, which you can use to send in your questions. You can do that as they occur to you. We will take them later in the program. Leave the default set to all panelists when you send them in. We're also going to do a couple of polls. So you'll see the polling panel open automatically on the right-hand side of your screen, and go ahead and answer our polls. We'd appreciate that. And you could download the deck using the URL on your screen. It's at the bottom of our slides, and it's also going to be sent out in the chat box. Okay, just so you see how we're going to spend our time today, first we're going to have our panel discussion featuring Dr. Shafiq Rob, SVP and CIO at Rush University Medical Center, Dr. Charles Jaffe, CEO at HL7 International, Corey Spears, Director of Healthcare Interoperability Standards with Infor, and I will be moderating again. So, without further delay, we're going to begin our conversation. Let me start with you, Shafiq. Can you give us an overview of Rush, please?
Rush University Medical Center is one of the primary academic medical centers in Midwest. We have a medical school, nursing school, health sciences school, and a medical center attached to it, which has about 700 beds. But as a health system, we have 2 other hospitals. What else would you like to know?
Oh, I don't know. I think that sounds pretty good.
And we are an innovative place where we have a lot of research, NIH grants, and we are involved in multiple drug trials and things like that.
Very good. Very good. Chuck, can you tell us a little bit about HL7?
Gladly. HL7 is now 31 years old. We're a worldwide organization in 35 countries. For almost 30 years, we've been an ANSI standards organization, and we comply with the requirements through the ISO approval process. Most of our standards become ANSI and then ISO standards. For the past 6 years, we've been committed to providing all our intellectual property free of charge, and FHIR is no exception. So the information that you gather, the training and so forth, can all be accessed online. Thanks, Anthony.
Excellent. Thank you, Chuck. Corey, a little bit about Infor?
Sure. Infor is the 3rd largest private tech company with nearly $3 billion in revenue, approximately 14,000 employees, of which there are 9,000 engineers. So in short, we do technology. We have a heavy investment in ERP, like finance, supply chain, HR, client management, and such. In healthcare, we are probably most well known for our flagship product, the Cloverleaf Integration Suite, which enables data flow, routing, translation, transformation of data in between various healthcare-related systems. And we have approximately a third of the market for the Integration Engine Suite, and we're moving quickly towards API and FHIR enablement.
Okay, very good. Thank you, Corey. All right, Chuck, let's start with you. Take me through the last 18 months in terms of the development of FHIR. What have the advances been? What's new that people should know about? And I list a few things you may want to provide details on, and you may have some others. So, Chuck?
Yeah, gladly. Thanks, Anthony. FHIR celebrated its 5th birthday more than a year ago. Many folks have the misimpression that it's a new technology, but it actually emerged from the Fresh Look initiative at HL7, in which we embraced the legacy technology as a learning experience. And we asked an important question, what can we do to advance interoperability? Unique challenge in that it was predicated on focusing on the implementation community, not on the folks that write the standards. And as such, it's always been imagined as a tool for implementers. In October 2014, the Joint Standards and Policy Committees of ONC issued a report. In brief, it said that the future of interoperability lies in open APIs and the technical capability which they provide. The committee members broke out that evening, and a handful of them met in a Greek restaurant and formed the Argonaut Project. It was envisioned to support not only the development of FHIR, but also the implementation community. And when I announced it from the podium in December of 2014, there were 25,000 tweets that day. Most of them said things like, you mean Epic and Cerner are really working together? Well, I'm delighted to tell you that now, 18 months later, they're not only working together, but in the progress that they've developed, there's been an enormous appreciation of the collaborative efforts. The announcement of multiple organizations, including Athena, SureScripts, Meditech, and others, to support this project. Not only is it capable of a real progress in FHIR implementation, but also has provided some key learnings in other countries that have adopted the Argonaut implementation guides. One of the vital steps in FHIR implementation was the marriage of FHIR and the SMART project that was nurtured at Boston Children's Hospital. SMART provided an infrastructure which enabled inter-system interoperability by allowing ISO standard for authentication and security to be embedded into the FHIR platform. That was a major breakthrough. Recently, Smart on FHIR has become a work product of the HL7 Foundation. During the intervening years, there have been a couple of key milestones that really have been transformative for FHIR. These include, but not limited to, CDS hooks, the clinical decision support technology, which really enables a host of standalone systems for clinical decision support to integrate into the FHIR tool. The FHIR has been successful in part because of its international scope and the access to the standards worldwide. The partnerships that we've enjoyed with a host of organizations have really accelerated the development. Some of the success has been the transparency of FHIR development. Unlike many other HL7 standards, FHIR is predicated on the rule of 80-20, implying that not all edge cases are embraced within the FHIR resources, but instead FHIR can be enhanced through ISO-based extensions which enhance, not break, interoperability. Lastly, and I think most importantly, has been a clear roadmap which has been embraced and nurtured through not only the HL7 process, but a broad consensus around FHIR. Some of the learnings have contributed to the release of FHIR 3.0, which was published early this spring. The roadmap also outlines the development of FHIR 4.0 to be published sometime in the winter and validated early in the year. FHIR 4.0 will be the first ISO and ANSI normative standard, but throughout the development of FHIR, there'll be continued enhancement of the resources, only now there'll be a promise of backward compatibility. Regardless of the maturity of FHIR, there's a robust maturity model in which end users or implementers of the FHIR standard can see in what countries, in what implementations, and what other broad opportunities there are for the maturation of the FHIR resource. So we're looking forward to 2017 and 2018 with an optimistic outlook. Later in the program, I'll outline some of the opportunities for all of you to participate, not only in the FHIR education process, but also in the broader FHIR community. Thanks, Anthony.
Very good. Thank you, Chuck. Okay, Shafiq, talk about your work with FHIR at Hackensack, where you just came from, Hackensack University Medical Center in New Jersey, near me. You were there for a while, just went over and started at Rush in January, I believe. So, and I know you were very active with FHIR at Hackensack. So talk about your work at Hackensack and your work at Rush. Describe the project, successes, and challenges, and talk about your overall impression of the impact FHIR has had on the industry to date.
Okay, so thank you, Anthony. First of all, in 31 years, HL7 went up to version 2.7. And FHIR has now reached version 3 and will very soon have version 4. So, Hackensack University Medical Center, when I was there, in 1 year, we did about 1.5 million transactions using FHIR. And we were brand new in it, and I believe in it. And the EHR companies that have supported us, they also did not have FHIR capabilities. Chuck was eloquent about how they are all developing now so that interoperability can happen. FHIR is like a Bluetooth. It doesn't matter what EHR we have. It has a bunch of resources that allows people to communicate with each other. We not only did that in our last job, and I'll tell you what I did here, is that we communicated with 5 different EHRs, and EHRs are semi-EHRs, and by using Infor's common service layer, we were able to write into our EHR when it was not ready to write FHIR and convert that to HL7. We were the beginners and the pioneers. It was a hard climb. It took us ourselves, at least me and Jeremy and Moody, who worked for me in the past jobs, it took us 2 years to get there and to understand it. At the same time, 3-4 things happened because of that. First, the training is very easy. Anybody can get trained on FHIR and very quick. Second, the connectivity is speedier, faster. Security is inherent and built into it. And massive amount of data can be transferred. For example, Sync for Science, which is trying to get 1 million records together. And FHIR brings people together to do interoperability. And we could bring discrete data, discrete information directly into our EHR, regardless of what our other EHR was. When we came to, at least I came to Rush for 4 months, I built my team and got people together. And finally, we said, okay, we should build a FHIR server here. Believe it or not, it took us less than 2 weeks to raise a FHIR server get connected to our EHR, and put an API out there and become meaningfully use 3 compliant. So if I would have done that for HL7 or any other way of doing that, it would take me longer to do that. So people who say that FHIR is going away or FHIR is very hard, and not that many people are in FHIR. Over 100 companies that I know of are working on FHIR and FHIR interoperability. And it's my offer through this to all the clients who are listening. If anybody needs to raise a server, they can contact me and I can help them to raise it. It's not that big a deal. Also, we're doing now other projects in which we were not able to connect before. Now we can connect using FHIR protocol on both sides and not only get the discrete data, but also connect using social determinants to help people to connect to each other.
Very good. Very good. Thank you. Thank you very much. Look forward to hearing more from you. Corey, let's move to you. From your perspective, talk about the evolution of the standard over the last 18 months, and what can you do for and with customers that you couldn't in the past? So how does FHIR help you be better at what you do?
Sure, Anthony. If you don't mind, I might have to geek out a little bit in this response. So
Go for it.
So a little over 18 months ago, the draft standard for trial use 2, or DSTU2, was released, and at the time there were about 93 resources, and now with STU3, that's standard for trial use 3, we have 117 resources. And a lot of work's been done by domain experts on those types, on particular types of resources, and we don't have just new resources to help interoperability with FHIR. We have a maturation of existing resources. So Chuck mentioned a maturity model for these resources, and that includes things like the ballot status and testing and verification and quality standards and actual real-world use. So there's maturity in the standard that's being done. DSTU2 is also the first version to get some real-world use through Smart on FHIR and then Argonaut Project help mature the standard even further. We have things like JSON schemas in STU3 that was not in the previous version. Test scripts have improved. We have better connectathons. That means we have more participants and we have deeper testing of the different components of the FHIR standard. And now we're not just looking at testing out resources and individual workflows through the connectathon. We have newer events happening, such as the joint HL7 AMIA Datathon, which was looking at use of FHIR for data analytics. And we had another mini connectathon recently for value-based care. So we're looking at actual real-world use cases in using FHIR. There's more formal testing capabilities. Vendors have just recently, in earnest, started working with the test scripts at the connectathon. And I'll try to keep this short, but one of the real technically beautiful things about the standard is it's computable. You can generate code from the specification, schemas, validators, and even create test scripts. Historically, our standards in healthcare have been developed by word processor or spreadsheet, and they weren't overly computable. We had some tools to enable, but with the FHIR standard, the actual creation of the specification itself creates all these artifacts. You don't have to create specialized testing tools which can generate errors, right? So from an operational standpoint, a number of EHR vendors with significant market presence have expressed their commitment to FHIR and have indeed started incorporating it into the system. From our standpoint, this will greatly assist in the maturation and use of the standard, and will give providers the opportunity to find new and innovative solutions for the specific use cases they want to explore. For our customers, this means more data is available to access and communicate with other systems, which my company can help facilitate. And as these APIs mature, it provides industry and our customers a great opportunity to integrate with systems, work with new workflows that they had not been able to do in the past. It's good to note that EHR systems, while they may be good at what they do, cannot be everything to everyone, every health system, every department, every specialty, right? So the movement towards FHIR APIs opens up a lot more flexibility for our customers and gives my company an opportunity to help them enable these new workflows and help with data orchestration. Thank you.
Okay, I don't think you geeked out too badly, so that was pretty good.
Okay. Yeah.
All right, now we're going to open our first poll. And again, this is so Chuck over at HL7 knows how better to help everyone and serve everyone in terms of getting involved. There are diverse HL7 FHIR training opportunities from a perspective of both approach and venue. What is your preferred training modality? And you can choose more than one. So whichever of these types of training you like, check it off and submit the poll results. And whichever ones you don't like, obviously don't check them off. So if you would do that, Chuck and I would both appreciate it. Thank you. So we'll leave that open for a few minutes, and we will move on with our discussion for now. So, Chuck, let's go with you on this. For first hear from you. What is your advice for CIOs who wish to start working with FHIR?
I think the most important thing is to get a commitment from the leadership. This is not something that should focus only on the IT function of an organization. It's important to have buy-in that the seamless exchange of data is critical to the business needs of your organization. In the past, we've relied on intra-system interoperability. FHIR is emerging as a critical solution for inter-system interoperability. It's key that this business distinction is made to the leadership so that they understand that for analytics, for accountable care, for precision medicine, and for population health, this exchange capability is essential. I think the CIO needs to team with the other leadership in the health organization to bring this to the fore.
Very good. Thank you. Shafiq, your thoughts on advice for your colleagues who want to start working with FHIR, other than giving you a ring, which you mentioned they could do?
Oh, no, thank you. I think Chuck very eloquently said, all my CIO friends and me and myself, we always look at the first question is, what is the problem we are trying to solve? And our job is to solve the problem of the institution. One of them is how do we get information in and out? Second is that how do we provide business insight? And once we understand that, one of the things is that each major EHRs, they're all working on raising their FHIR and FHIR servers, and they also have, they call it a hackathon and learning sessions. So they should allow their interface people, their people who are innovative and creative people, to go learn and participate in that. Second, use the FHIR.org, which is a free place to learn and understand it. Lastly, most of the things will be API-based as we are moving into the world of apps and as we are moving into the world of patient experience and patient outcomes. Key in those apps and API and transaction is how do we get this information back and forth real time and discreetly. So my advice to myself and to my colleagues is that get people trained as fast as you can, and it is not difficult. And I did it twice. So what I'm trying to tell you is that also attend some of the seminars and sessions that are held by the FHIR community. And they're very open people. It's not like closed. It's like some kind of a secret society. It's not like that. It's totally open, and everybody helps each other. And there are so many use cases that has already been published. A lot of people have done it, and people are willing to share that. I think you will not find it any more cooperation than the FHIR community anywhere else. So lastly, what I would say is that also look at people who have done it before. Companies, big companies like Google, Apple, they're also looking at FHIR capabilities. Because the beauty of all of this is that it's easy, it's fast, and doable. You don't need like 2,000 years of training on this. So the only thing is a commitment towards resolving it through a business solution that the institution needs.
Very good. Corey?
Yeah, it's really hard to add on to that. Both Chuck and Shafiq really covered a lot of what I was thinking. Ultimately, this is about solving business problems. Don't get too wrapped up in the shiny new object of FHIR. FHIR as a tool enables a lot of new things, but make sure you're looking at your business problems first. Are you having an issue with appointment scheduling times or patients not showing up for appointments? Perhaps FHIR can enable patient scheduling and reminders. And this has been proven at Shafiq's Hackensack University Medical Center. Right? Do you have an issue with workflow management across your clinical and operational or ERP systems? FHIR may be able to help you out there as well. But first look at your business problems and then try to understand how FHIR can help out. And to kind of echo what Shafiq mentioned, this is a community. Reach out to HL7, reach out to me. I'm part of that community helping develop the specification standard, and I'm free to talk to about that. And it doesn't have to be necessarily an Infor solution, or I'm not selling you anything. I'm not a salesperson. Just reach out to the community and myself. And one thing I'd like to add, though, it's important to note that you already have an active interoperability ecosystem in your healthcare system or in your health system, right? So keep in mind you'll have legacy systems that may speak FHIR, may not speak FHIR, and maybe never will. And there are solutions out there to help you manage that transition to get FHIR systems connected to, or non-FHIR systems connected to a FHIR ecosystem. So don't think that this has to be an all or nothing and never. Like you have to bring up all your systems on FHIR. There's technologies to help you with that.
All right, very good. Not a secret society is my big takeaway from that last question, which is good to know. All right, Dr. Rob, let's go with you on the next question. Where does FHIR have room for improvement?
I think that the breaking news may come from Chuck, but the improvement are the following. The EHR companies that are presently participating in FHIR, some are doing read-only, and some will announce with the newer version, and some have already, like I have a company that I have a EHR with, starts with the letter E, and we will be able to now write for the first time directly using the EHR instead of having a common service layer. Second thing, that means read and write. Second thing that the FHIR itself is maturing, and the maturity model has reached a level in which standards and other things are there. And Smart on FHIR also has made FHIR very robust, but I think the place where it can become more useful when 3-4 people get together. That means the payer for healthcare, the payer, the provider, and then the patient. Those are the three places FHIR has to go forward more than what it is today. It took so long to get it there because, hats off to Chuck's leadership and his commitment and his friendship to the community that he has helped us get where we are. I think we have moved past the pivot point. I think this will go like a storm by this December. FHIR will become more common, and I'm expecting very soon or someday CMS will also announce that they are FHIR compliant. And when that happens, everybody will follow.
Very good. Corey?
So again, looking at this technically, each resource in the FHIR standard has the maturity rating, and those with the lowest levels have the most work to be done. That's sort of the technical thing. But I think ultimately the best way to improve the FHIR standard is getting traction in more real-world use. So we have these newer events, these datathons and use case specific connectathons. I think that's great. It's going to help mature the standard. Right now we need more real-world production use of these use cases, and where the value can be proven. I think it will take off from there.
Very good. Chuck, and you may want to give us your breaking news now.
Well, no, let me offer some areas for improvement. I think one of the key issues around true semantic interoperability is for the sender and the receiver to agree upon what they mean by a certain data point or a certain concept. And that's really not clear. For the clinicians on the line, I think they're no surprise that two organizations or two physicians don't always agree on what the common terminology is or even a concept. Try to define when you've had a heart attack or what it means to be have active rheumatoid arthritis. Those are real challenges. So on July 13th at the NIH Maser Center, we are going to have a meeting of clinical societies, of individuals and organizations that have a stake in semantic interoperability to come together and discuss what needs to be developed in order to make FHIR achieve the promise that it has at a technical level. And I think this will be a groundbreaking event, and I, for one, am looking forward to that meeting. So I welcome all of you to go to the HL7 website and register for that event.
Excellent. Thank you very much. All right, Corey, let's start with you on this one. What would your message be to developers who are creating FHIR-based apps?
For this one, I'm going to go completely non-technical.
Okay.
People to keep in mind what the goal is. Ultimately, this is about care, health, and well-being of people, actual human beings, right? A mother with a family that just discovered she has cancer, a premature infant baby girl whose parents are struggling with, what to do next to properly care for their little one, or perhaps your own father who is in need of a little extra care to manage their chronic condition. There's a lot of opportunity FHIR represents, a lot of opportunity that the standard opens up. Just keep in mind what this is all about foremost, and you should help you lead you in the right direction.
Very good. Chuck?
Is this an appropriate time to discuss the opportunities for developers?
Sure, why not? I mean, we can, do you want to go to your slides now?
Yeah, sure.
Okay. See, we go with the flow here. Just call next when you want me to advance.
Yeah, next slide, please. So there are four really key opportunities for those interested in developing or implementing FHIR apps. The first of these is Partners in Interoperability. This is a listening session for HL7 and for the FHIR community to understand the business needs, the workflow, the conditional requirements, and really the data components that support better patient care, better patient integration into the decision process, population medicine, and really the future of accountable care. Our next meeting, following on 2 outstanding events at Johns Hopkins and Georgia Tech earlier in the year, will be held in December at LSU. Next slide, please. We have enormous support from the FDA in their Open FDA program that was really a breakthrough for government agencies. From the biopharma community that really couldn't abide by $2 billion for a new drug and the continued demands of a classical double-blind placebo-controlled trial, and the genomics community who's developing data and analytic solutions faster than they can be incorporated into decision-making process. We're not going to be successful with precision medicine until our genomic data can be mapped into our phenotypic data. We will hold our genomics summit, providing an opportunity to use FHIR, to use the Sync for Science, Sync for Genes, CDS hooks, and other technologies to integrate genomic data into the clinical record. Next slide, please. We have had a program called the FHIR Application Roundtable. It's the most fun that I have had. In that event, we have 15 minutes each, and we've had nearly 40 developers present real-world solutions, principally in production, but also in pilot phase, in which they have really innovative approaches to using FHIR to take better care of patients, deliver better data, and to ensure patient-centric care. The last event was held in March, and we'll have one following the Partners in Interoperability at LSU in December. So all of you who are considering developing an app or have developed one and would like to showcase it, it's a remarkable opportunity. The most fun comes during the breakout periods when app developers meet one another and realize the future of collaboration. Next slide, please. The last of these is really a exciting 3-day event. It ranges everywhere from the business training on FHIR integration to the hands-on connect-a-thon to the learning experience. There will be one in Amsterdam in the beginning of November. That has a large U.S. contingent. Nearly half of the participants are U.S.-based, and a U.S. event held in June next year in Boston. So I encourage all of you to investigate these opportunities because it's more than training. It's about how you become integrated into the FHIR community. Thanks, Anthony.
You got it. Thank you, Chuck. Shafiq, any thoughts for developers from your perspective?
Yeah, for the developers, both for healthcare and within the industry also. In 1904, Baltimore burned down. And one reason for the fire's long duration involved the lack of national standards. And then people got together and built the couples that could actually fit in the same, whether the fire truck came from Baltimore or Philadelphia. So let's not wait for a national tragedy to happen, not to work on FHIR and not to build that standards, because one of the critical things that limits a clinician to provide the right information at the right time in the right format for the right person to do the right thing securely is because of lack of standards and people coming together. So one of the things that allows that to happen is the FHIR protocol and a smart on FHIR. And for the developers, and what's happening is that as we are moving into the world of appification, in which everything is app-based and coming to it, so security is important and app management is important. But the protocol that allows the information to freely flow from the EHR to the hand of the patient, and from the hand of the patient back to the provider or to anybody they want to give to, or using one's data that will go to a scientific place. By 2020, 20% of the world's data will be made or provided by China alone. There are so many people who live there. So, but that information is in Chinese. So how do you bring it to understand cancer, to understand humanity? FHIR is the window that allows interoperability to look into humanity. So therefore, this is a noble task that all app developers should take immediately.
Wow, there's a quote. Very good, Shafiq. Thank you very much for that. We're going to open our second and final poll now. So go ahead and take a look at that. Again, this would be helpful for Chuck. Involvement with the HL7 FHIR community takes many different forms which vary with business needs and desired level of participation. Please choose a level that is most consistent with your business or professional requirements, and you can choose more than one. So again, take your time, check off what you think you would like, and that will be very helpful in HL7 crafting its FHIR programs. We appreciate it. All right, next question, Dr. Jaffe. What is FHIR's future? What can we expect to see over the next 18 months? Talk about some possible future use cases for FHIR, in addition to things you've already covered.
Yeah, I think the future is exciting. I think we've always believed in the adage that a standard is not something that a standards developer creates. It's something that people use. FHIR will continue to evolve. We will not achieve the optimal state ever. There'll be new advances in healthcare, new advances in information technology. Who would have envisioned 10 years ago that we would all be using smartphones, which were far more powerful than the mainframes that the last generation embraced? FHIR's normative release next winter will only be a stepping stone to the creative and remarkable achievements that private sector companies like Infor and healthcare systems like Rush are creating every day. I'm privy to some of the work that the big technology vendors are beginning to roll out. I looked into the future of where genomics can take us, and I'm excited when future development will support all of the biology and scientific breakthrough that is just on the horizon. So I think in the coming months, there'll be a host of announcements about integration of data seamlessly into decision processes, patient care, and research.
Okay, very good. We have a few minutes left, so I think we're going to move to our audience Q&A. Let me go with you, Chuck, on this first question. When do you envision that FHIR will be capable of extracting quality EMR data for ACO-based quality measures from EMRs, and they specifically mention eClinicalWorks and Athena?
Well, I had a call earlier this morning about such a process. In fact, we're now developing a mini Connectathon for quality measures so that the data can seamlessly move from the EHR into the databases that report this out. One of the interesting partnerships that we have is with the CDC. Nearly half of the 3,000 public health agencies still report their data by faxing an Excel spreadsheet to CDC headquarters in Atlanta. One of the opportunities is to extract public health data directly from the EHR so we get better ideas of outbreaks, clusters, and other population health problems. And finally, there's an initiative within HL7 about integrating quality reporting into patient care workflow. So it no longer requires separate events, but the clinical record describes care quality events.
All right, very good. Next question from the audience. Progress on FHIR and related tools is impressive, yet patient identification and data standards remain as significant barriers to effective interoperability. How far can we go until those issues are resolved? Shafiq, thoughts on that?
I was trying to look for the question, but I don't see on the.
Oh no, it just came in to me, but you could probably see it if maybe in the Q&A box. I'll read it to you again. Progress on FHIR and related tools is impressive, yet patient identification and data standards remain as significant barriers to effective interoperability. How far can we go until those issues are resolved?
So data, this is a phenomenal question. Whoever asked is a genius.
That's our buddy Bill Spooner. I got to throw him out there since you called him a genius.
It's a very phenomenal question. Patient ID will still struggle with it till we. So I'll tell you how we resolved it, and then people can understand. When the government announced HISP so you can securely send any message to any physicians, what we did is that we also started giving HISP to patients, so that once you give a HISP address to a patient, you already know who the patient is, and in that way, when they communicated back to the patient, or patient communicated back to the doctor, they already knew who the person was because they were authenticated and they were taken as the person who they claimed they were. That was one way we took care of the patient ID. Second, there are standards that people do. We also use techniques of like credit card, the way they do their authentication of a patient ID. And after connecting all of that, we again use FHIR to exchange between two entities. As far as data standards are concerned, FHIR resources, the 22 that we have done so far, we are using the FHIR resources to resolve between two people, or two institutions, or two EHRs, or two, even if it's not an EHR, company that is exchanging data with us, so that in the world of FHIR, and if they're using the resources, then we go to a place where we talk to each other and understand what we are doing. But there has to be work done on the low-end side. There has to be more work to be done on data standardization. But in the meantime, while people are working on it, life has to go on, care has to be provided, and information has to be exchanged. So we are doing different methodology to bring that information in so that the right information for the right person in the right format at the right time can be taken into consideration.
Chuck, any thoughts?
I can add to that, Anthony.
Go for it.
Under the umbrella of the Argonaut Project, which now is part of the FHIR Foundation, care quality at the Sequoia Project and Commonwealth have agreed upon a common format to improve patient identification. And I think in the coming months, we'll see that challenge move forward. It's an incremental approach. It will never take the place of a unique patient identifier. And I don't think anyone has that fantasy. But I think we'll see an improvement in patient identification. One of the challenges, of course, is if you've ever looked at your credit report, you see not only other Guerras on your report, but there are other Anthonys who don't live in New Jersey and don't share an address or social security number, and yet they've managed to be on your credit report. I think when that happens in healthcare, we have a crisis. It not only ramps up the cost of care, but leads to some tragic errors. I think in the future, there is a promise that the government will relax its prohibition on research on patient identification, and right now we're actively lobbying for that to take place. So I think in the next year, some significant changes are afoot.
Very good. Corey, your thoughts, and we're going to give you the last word today.
You put me at the end following these great people. I try to add something to this. Thanks, Anthony. It is a significant challenge. Of course, we've been in this industry for a while. There's talk of a national health patient identifier, and there's, I think, a challenge going on about that now. It's fraught with challenges and concerns about privacy, and even even if we did have a national health patient identifier, it wouldn't solve all the problems, right? There's missed keys, there's issues with people not having the identifiers, and then making sure that you have the right identifier, right? There have been sort of pseudo-identifiers being used in the industry now. They're getting more use. We have email addresses and mobile numbers, which are helping us identify patients. And FHIR by itself doesn't answer that problem. There's going to be a lot more work in the industry in order to do it. FHIR can help, and there's a lot of activities going on. In fact, the ONC has a patient matching algorithm challenge that opens next week. So it's still being looked at. The industry's looking at it. The government's trying to address it, and it's going to be, as Chuck said, it's going to be an incremental. And so for my last word,
Go ahead.
Chuck, this is a little off topic, but Chuck mentioned it, and I was remiss that to the developers, to all the people out there that are looking to get into FHIR, one challenge that I heard is like, well, I don't know how to begin. Begin with the community. Reach out to one of us. Any of us will be glad to help you to get you associated with FHIR, to sort of get you oriented, and just join the community.
All right. Excellent, excellent. Well, I want to thank everyone for joining the event today. When you close your WebEx window, you'll be taken to a post-event survey. If you could take a moment to answer that, we'd appreciate it. For those of you with continuing education interest in today's event, attending our webinars gets you 1 CEU towards the CHIME CHCIO program, so let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when a recording of today's event has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can contact Nancy Wilcox. Then you can go to our website to view our upcoming schedule of events. So with that, I want to thank our panel very much, Dr. Shafiq Robb, Dr. Chuck Jaffe, and Corey Spears. I want to thank our sponsor for making this possible, Infor Healthcare. And I want to thank you for coming to our events. We appreciate it. So with that, everybody have a wonderful day. Thank you.
Thanks.